Dr. Carolyn Ansley is the founder of Centrepoint Restoration Project, a website that serves as a connection point, archive of information, and safe landing space for former children of New Zealand's notorious Centrepoint cult, with which Carolyn has personal experience. She is also a general practitioner with over 20 years clinical experience in community medicine and 10 years experience working in clinical leadership in the Canterbury Health System. As Senior Clinical Editor of Canterbury and West Coast Community Health Pathways, Dr. Ansley is uniquely positioned to help health practitioners navigate the complexities around healthcare when it comes to current and former cult members. It's an area I looked into when I was researching my book, but I had no idea how little research has addressed this pressing need, which is why I couldn't wait to hear more about Dr. Ansley's work. Welcome to Let's Talk About Sects, a podcast about cults around the world. I'm your host, Sarah Steele. Before we get into the episode, a content warning. This podcast deals with issues that some people may find disturbing related to emotional abuse and controlling behaviours. This episode also includes mentions of child sexual abuse and stillbirths. Please use your discretion as to whether this will be suitable for you and those around you who may be listening too. You may recognise Carolyn Ansley's name as a co-host of the Cult Chat podcast, and if you haven't listened to that one yet, I suggest you do. It's an award-winning collaboration between the Olive Leaf Network, the Gloria Vale Leavers Support Trust, and the Centrepoint Restoration Project. Carolyn also featured in the 2021 docudrama Heaven and Hell, The Centrepoint Story, and is the lead author of an open letter signed by over 50 former Centrepoint members and children. Addressed to the adults of the former Centrepoint community and published in the New Zealand Herald in 2021, it asks the adults of Centrepoint to make right the harms that they caused or allowed to happen to the children. But today, it's Dr. Ansley's experience as a healthcare professional that we drew on to examine some of the healthcare issues found amongst those in cults and those who have left high-demand groups, and to discuss what might help improve outcomes. Carolyn will be speaking about this topic at the Decult conference in Christchurch in October, where I'll also be speaking about media representations. Tickets are now available to the live event, which you can find linked in the show notes, while streaming options will be on sale soon for those who can't make it to New Zealand. Dr. Carolyn Ansley, thank you so much for joining me today. First up, can you tell me a bit about Health Pathways and what it does for those of us who aren't familiar?
Right, hello, and lovely to be here, Sarah. It's nice to have this privilege to be on your show. I really enjoy it, so I feel very special that I have an opportunity to be on the show. Health Pathways it's a job I've been working with Health Pathways for 10 plus years, and in the last 5 plus years, I've had a fairly senior role in the organisation here in New Zealand. So Health Pathways is a web-based platform that doctors, mainly community-based doctors, but also we have some platforms in hospitals in New Zealand as well. Doctors and nurses use in their day-to-day clinical consultations with their patients, and it helps them navigate up-to-date evidence, which is very challenging for healthcare workers to keep in contact with, and it also helps them to understand what's happening in secondary care, like the hospital system, because criteria for accessing secondary care services changes all the time, and when you make a referral into a specialist, you want to know that it's going to be accepted, so things like that. So it aids communication between the primary and secondary service, and it helps to make sure, for instance, if you want your patient to get a hip replacement, that you do all the right tests in advance, so when they get in to see the orthopaedic surgeon, the surgeon doesn't go, oh, you didn't get the x-ray, or you didn't get these blood tests, oh, go away and get those done before we so it aids efficiency and smoother running of the health system, and it cuts down some of the waste, and it aids primary care, so the doctors like myself, to do more in the community, which is better for the patient. They want to do more in their own community usually than going to the hospital. So this started up after the Christchurch earthquakes that happened back in 2011. I've forgotten actually, because our systems weren't operating as well as they could, and it became really successful in Christchurch, in Canterbury, and then spread across New Zealand into all the other health areas in New Zealand, and it also spread into Australia. So it's all over Australia now. And I just counted up earlier, about 30 different platforms in the health systems in Australia have health pathways. So it was very successful. It helped our system, our health system, to join up and operate better. And that's why it's been really effectively operational across New Zealand and Australia, and Britain and Wales now as well.
Oh, fantastic. I didn't realise that it spread over.
Yes, yeah. So the program that I run is the Canterbury program, which is where it started. So it's the most mature program, and it's the biggest program of all of the health pathways programs. And it's a pretty special program. It's a community of doctors who all work together to produce this information across these different, about 40 platforms or 50 platforms. And yeah, it's been very successful.
Wonderful. And you've been working on a specific pathway for the organisation. So I just wondered if you could share how your personal experience fed into this pathway and why you saw an urgent need for it.
Well, yeah, when I was a kid, I lived in an area of Auckland that had a cult up the road called Centrepoint Community. And it started up there when I was really little, and all the kids from that cult, it was a psychotherapeutic cult with lots of therapy that happened on the grounds. All the kids that went to that community, it was a living community, went to my local school, and they were all my friends and my siblings' friends also. And there came a time a few years later that my family disintegrated, and I ended up being put into the Centrepoint community to live with the family of my closest friend for several months of that year. And ultimately it came out that Centrepoint was a very destructive community, there was a great deal of child sexual abuse, and there was drugs being manufactured on the grounds and given to children and being used to reduce barriers, psychological and physical barriers, and increase sexual contact between children and adults. So it was a pretty unsafe community. And yes, then I got out and life moved on. And so that's my connection. That's my connection to the cultiverse, is that experience of, pretty unpleasant experience in a childhood. Ultimately, a large number of the leaders of the community ended up in jail for those sex and drug crimes. So back to the pathway, as I've done my own personal work and learnt more about cults in New Zealand and cults in other countries, it's become increasingly obvious to me that there's a really significant focus on the psychological harms that happen in cults, which is a very valid focus. But what I've learnt, or what I've discovered in all my readings and talking to people who've come out of groups, is that there's a lot of physical and not just psychological harms, though psychological and physical, we're all one body, our brain and our bodies are connected, so it's not like you can divide a person at the neck. They interact with one another. But as a family doctor, I'm a general practitioner. I've been working as a doctor clinically for 20 plus years. It all connects together. And if you're living in an environment that causes severe psychological harm, well, it's, the rest of your body's going to be affected as well. So I'm looking at this whole picture as a doctor, and I'm thinking about what I experienced, and I'm thinking about what I'm hearing from the survivors of Centrepoint, the community I was involved in. And I just started to see patterns through the lens of my medical training. For instance, what I was hearing from the children of Centrepoints was a high rate of dental disease that they experienced and were managing and navigating as adults. And often, like in poverty, they didn't have a lot of financial means, and they had really serious and severe dental dental health needs as a result of lack of dental hygiene, lack of access to a toothbrush and toothpaste, and lack of oversight from parents to make them brush their teeth. So that was playing a really significant role. Another one I heard about was chronic constipation. At Centrepoint, there was no physical boundaries on the toilets. There was only one toilet in the whole community for like 200 or 300 people that had a door. All the rest of the toilets were out in the open. And that was a very public way to kind of basically do poos. So some children ended up with quite significant constipation as a result of withholding. And that leads on to have significant consequence in adulthood.
In the work I've done, I've seen healthcare neglect time and time again across different cultic groups. Many religious cults teach their members that they should rely on God to heal them and that illness is a sign of some kind of sin, or the more New Age groups might teach that it's penance from a past life or something like that. My running theory is that most of these groups are trying to minimise interactions between their members and healthcare experts who might see something else awry with a patient, and of course as another method of control. Does that gel with your understanding as well?
Oh, absolutely. And that's what I think it is too, because, there's a really serious sort of outsider paradigm that the people in the group have got the ultimate answers, that they are sort of superior and more evolved, and people on the outside are inferior and ignorant and to be feared often. And that's a very effective way to keep people in and keep people committed and afraid. And if you need to go into the outside to access services, which invariably you do at some point, that's risky, right? And the thing about the health professions, I mean, our job is to care for people. I mean, our job is to put the person in front of us first and foremost. And that's how I was trained. A person walks into the door and they tell me they've got a problem, and they are absolutely the utter focus. Their needs, what they need, is the first and the only thing for those 15, 20, 30 minutes, however long I've got them for. That's putting the best interests of the person. The patient is the whole point of what I do as a doctor. And that is the antithesis of what a cult does. The antithesis, a cult or a cult leaders, the leadership want this person to put their needs and interests last. And they want this person to sacrifice for the group. They don't want them to meet a caring, interested person who will put the needs of the person in front of them first. And that's the driving goal of health professionals, care and compassion. And not only that, but they're highly trained and they've got the ability to see through smoke screens, invariably. So I think that is very threatening for a cult. They bring with them information that's counter to what the group or the cult leader is trying to sell. Often cults have got some really quacky ideas that really run against basic science. And that again is, like counter. But I think actually fundamentally and foremost, a doctor is evidence that people care on the outside. It's living, breathing evidence. Like whenever I go to hospital, because I've had to recently for a few things, I just get struck repeatedly about how nice the nurses are. I mean, I might have struck some really kind ones and had some really good luck, but I always just think, why are you being so kind? You're just looking after me. You're doing all these really basic cares for me and I feel so vulnerable, and you're just caring for me. And, a hospital admission for 3, 4, 5 days for a person who's a member of a cult, that's threatening. That must be very threatening for the cult. This person, they're here, they're going to get loved on for 3, 4, 5 days. And that's the opposite of what they're taught about the outside world.
Yeah, I really hadn't thought about it in that way before, but you're absolutely right, because the cults are very often teaching that nobody outside really cares about you, and it is just such in-your-face evidence that is untrue, that you've got this person who's totally interested in your well-being.
Yeah. And if I think that, I don't have I don't have that distrust. I don't have that phobia about the medical world. If when I go into hospital, just as a person who's used to being the caregiver, I look after my kids, I look after my family, I look after my patients. So to be in that receiving role in hospital where I'm cared for and to be so moved by it, you know, if I feel that way, what's it like for a person who really often doesn't experience a lot of care in cults, ironically, you know? They actually get squashed and oppressed and ridiculed and humiliated and worked their ass off, you know, like, yeah. So I agree with you. That's what I think it is.
Mm-hmm. Yep. And so on kind of the broader sort of healthcare issues that we see related to those in cults and those who've left cults, an example I think about a lot is a young woman who left a Hare Krishna offshoot group in the Northern Rivers region of New South Wales. And she wanted to get up to date on all the vaccinations that she'd missed as a child because her mother followed the teachings of the group that these were unnecessary, if not dangerous. But the cost was prohibitive for her to be able to do so when they would have been free when she was a child, but especially with everything else she was trying to pull together to get her life in order. And then there's also the high incidence of stillbirths that occurs in the 12 tribes, which some think may be to do with malnutrition and others suggest is around distrust of doctors, resulting in expectations of home birthing without a qualified midwife and distinct lack of antenatal care. Is this the kind of thing that the pathway that you're working on, these kinds of things you're looking to address?
Yes, absolutely. And in fact, it was listening to the 12 Tribes podcast, the name I've forgotten.
Inside the Tribe?
Yes, it was listening to that and hearing the telling of what sounded like really extreme healthcare neglect that was happening, particularly antenatally, that actually kind of first made me kind of click a little bit about, you know, all these different points of contact that people who are normal people in Western society who are accustomed to having a day-to-day or week-to-week, however, relationship with the healthcare system, how many points of contact are missed. And that I think that podcast did a really good job of highlighting that, to me at least. Yeah, the thing is, in my view, the average healthcare worker doesn't know a great deal more about cults than the general population. So their background knowledge is maybe not as low as the general population, but not a lot higher. Not the height of understanding that you'd expect from a doctor in any other area. Like, I know a lot more about asthma than I expect you to, or heart disease than I expect you to. But when it comes to cults, I think probably the average doctor maybe is as believing of the general stereotypes as the average person, and may not recognise that they have particular healthcare needs much the same way that any other group of people have. Like, elderly people have certain healthcare needs, children have certain healthcare needs, people with a spinal cord injury have certain healthcare needs. They have particular risk factors. They have certain things you need to look for. Like, a person with spinal cord injury you have to keep an eye out for pressure sores, things like that. So this is a defined group of people who've been in a cult, and they have some typical experiences and some typical failed access to certain experiences. They have some typical barriers to access to healthcare. And so I see them as defined group in much the same way that we could say someone with a spinal cord injury is part of a group of classic risk factors and signs and, risks and typical disease patterns, shall we say. And so the pathway is aiming to kind of look at first of all, how to approach a person who has self-identified that they're in a group or have been in a group, but probably before that, recognising that they're hard to spot. We've got a group here in New Zealand called Gloriavale where everyone wears a uniform and they're jolly easy to spot, but most people don't have a special uniform or have a little sign on their forehead, I'm in a cult, and in fact they may be fairly wary about answering questions of that ilk. So initially doctors or nurses have to get a sort of twig to the possibility that this person might be in a group that's harmful. So there's ways to think about that, and that's kind of the sort of first starts that I'm trying to kind of pull together in this pathway or series of pathways. Sort of what are some signs and symptoms that the person might be in a high control group? What is a high control group? What some of the features of it that you might hear about from your patient over time? How might you approach them? How you might want to focus on trust building over some other things. Continuity of care is really critical. When a person tells their story to you and tells you about their social history, that's critically important in a way that it's not so important maybe with other of your patients, that learning all the different people in their family is really, really important. What else? Just sort of things like that about building trust, recognizing the person, maybe recognizing that they have a minder with them that might not be safe, thinking about issues around confidentiality, that it's a lot easier to, in say a transfer of care situation, say passing on one bit of information to another doctor, it would be potentially possible for a breach in confidentiality. And in New Zealand, we have this thing called a patient portal where patients can see their own notes. There's an opportunity for confidentiality to leak out and that person to get to be put at risk. For instance, their leader or a supervisor in their group might read their patient portal and see that they've talked to their doctor about the fact that they're thinking of leaving. Like, that's a terrifying risk potentially. So things like that a doctor might not think about vulnerabilities and risks, like for instance, whether the text alerts, when your doctor sends you a text to say you've got an appointment, who's holding the phone, for instance, those sorts of ideas. So it's about framing the particular risks, the particular typical patterns of disease that might present, like for instance, lack of vaccination, lack of other preventative care, like screening for breast cancer, cervical cancer, the vaccinations in childhood and adolescence, risks in pregnancy that you wouldn't normally encounter, infectious disease that could happen in a way that you're not used to happening because kids might not be vaccinated, so everyone gets measles that you don't really expect, things like that. Plus what you were talking about before, about this idea that your illness is in some way, you're some way responsible for your illness, because that's the message that gets sent to you from the leadership. And that and of course it depends what group you're in. You might not be in a Christian-based group, but in some Christian or Bible-based group, the message is that God will heal you, and if you don't need a doctor because God will heal you, and if God doesn't heal you, then that's somehow a reflection on your faith, or that you're in some way to blame for that. And in any way, why would you go to a doctor? God will heal. So that's pretty dangerous in my view. And if it's might not be a Bible-based group, there still is often this idea that you're somehow responsible for your illness or your disease. I've heard people say that, I heard someone in Scientology say that if they took a medication, they'd no longer be pure. Someone told me who'd been in Falun Gong about the idea of not taking medications because, again, that same idea of not achieving their karma. So it seems like there's actually quite a lot of groups with like quite a lot of people in them internationally that spread this idea, that perpetrate this idea that Western medications, Western medicine, Western interventions would some way either harm you or reduce your access to heaven, or it's a sign of weakness, of failure, and it's a no-go, you don't go to the doctor at all, or there's a really strong pressure to only really access medical care at the really very, very late stage. And that can lead to some pretty serious outcomes.
That is 100% what I see across so many of the people I speak with who've come from many different types of cults. It's just a very common teaching. In your experience, what are some other factors that can lead to cult leavers not feeling safe around doctors and other healthcare professionals?
Well, I think fear indoctrination is pretty huge, that they're actually taught explicitly that harm will come to them if they see a doctor, that they'll be, that basically they got horns, devil's horns, that they're of the devil. So explicit phobia is taught to some cult members. But then is actually also some very genuine and real bias that they experience in the health system. And I guess that's where my work comes in, to try to break this down and move the average Dr. Joe Bloggs, Dr. Josephine, Dr. Joe, up from that fairly low level of understanding of the background general member of the population to what I would consider to be what we'd expect from a doctor. They should know more about a person's medical context than the general population. So to bring them up out of that kind of stereotyped way of seeing cultists, for want of a better word, to see them as people with a complex social context that heavily influences their capacity to access healthcare. To see the barriers and not just dismiss them as hard to make sense of or weird or stupid. You know, someone told me that they were in hospital and they were heavily pregnant and there was a problem with the pregnancy and they had to get a scan. And in that moment of real difficult health need, the strong message they got from the sonographer, oh, you know, another pregnant member of this group, you know, like kind of like that whole judgmental, what are you doing pregnant again, that kind of unhelpful, superficial prejudice, essentially. And I mean, I think which fundamentally comes from a faulty belief that people in cults have chosen to be there and they've chosen this way of life. They're not seen as a socially entrapped individual who is unable to get out of an awful situation. So, yeah, so breaking down some of that prejudice and bias that comes from the health worker themselves is part of the goal of the pathways. So I see two walls of bias coming from each direction. The person in the cult is highly biased against the doctor and they don't want to go and see them. They think all the wrong things about what kind of care or not care that they're going to get from the doctor. And the doctor sees the cultist or the cult leaver in a really pejorative, judgmental kind of way that is really faulty as well. So it just makes it incredibly hard for that person to get. They have much higher healthcare needs than the average member of the population, and they've got much higher barriers to access and care for that. So it's kind of a double whammy, really.
Yeah, absolutely. And coming back to that idea of choice, we also see some examples like the Jehovah's Witnesses teaching against blood transfusions, which in some cases in Australia has had medical professionals overrule parents in the case of juveniles whose lives were at risk. These decisions have been upheld by courts who have judged that the welfare of the child supersedes parental rights. But I'm interested in your thoughts around informed consent and how it intersects with cultic belief systems.
Well, that is a really interesting question. It's one I've been kind of really grappling with because, you know, one of our basic jobs as doctors, and certainly in the New Zealand health system, which has this, we have this thing called the Health and Disability Code of Rights, which is a list of 10, I think, rights that are enshrined in law about what health and disability providers of care to consumers, what the consumer's rights are in the consumption of that health or disability service. And all throughout those 10 rights is this idea of information, consent, dignity, no coercion. Yeah, those kind of ideas are all enshrined within it. And I don't understand how a person can, well, they can't make an informed consent if they don't have information. I mean, that's pretty obvious. And when you're interacting with a cult as a doctor, either you're in the cult yourself, so you're an indoctrinated member, which definitely happens. There was some doctors in the Centrepoint cult and they were very much indoctrinated. Or you're outside the cult and you're trying to provide services with this really big problem, and that the person in front of you is not free, your patient is not free to advocate in their own best interests. And so consequently, they'll make some really weird health decisions. They'll interact with the health system in a really weird way. And, you know, you would have heard of, Janja Lalich's bounded choice, this idea that you might have 4 choices in front of you, but only one of them's an option. So you don't really have a choice. There's no actual choice. And that's what it's like when you're trying to give your patient a choice. If you give them, as a doctor, interacting with a person in a cult, if you've been approved of by the cult leaders, the odds are you've had to kind of make some decisions about how you interact with the cult member. You have to make some compromises. That was the word I was looking for, because you're constantly walking this line of, if I treat this person in exactly the same way as I treat all my other patients, I'll get fired because the cult will find out and they'll kick me out because I've informed my patient. But if you don't treat them like a normal patient, you're failing your duty of care to them. For instance, in a cult that doesn't believe in contraception, do you give contraception information? Yes, of course you do. But then you get sacked by the cult and you never see the patient again. I personally don't have a practice with cult members in it that I'm aware of. So I don't know how colleagues navigate this. And what I do have is personal cult experience. And I've spoken to a lot of people about this topic. So a lot of cult members have talked to me about it. So, yeah, I'm not sure if I answered that question. It's actually a really hard question. I haven't actually come to any final or firm answers, because I think to make a decision about your health and to have capacity and mental capacity and competence, it doesn't actually legally talk about freedom. It talks about things like being able to weigh up the choice you're making, to be able to communicate about the choice you're making, to understand the consequences of the choice you're making. That's how we judge mental capacity, and when we're making choices about it as doctors, if the person has mental capacity. But it doesn't say anything in there about freedom. Can you make a choice for yourself and your best interests if you're not free to do that?
I think it's, an incredibly difficult question, and I think it's fine to not have a clear answer to that question, but it's definitely one worth grappling with, I would say. Yeah. And you mentioned the psychological side of that is focused on for cult leavers, and that's something that comes up very regularly when I speak with former cult members, is how hard it is to find psychological support from someone who has a proper understanding of cultic groups and what they entail. So I know you were speaking about how that does get a lot of focus, and rightfully so, but you're looking at other aspects as well. But how does the sort of referral side of things into various other aspects of the healthcare sit with the pathway process?
Well, my comment earlier about how the psychological impacts has got a lot of attention, the caveat for that, actually, what I should have said is, in the space of people who are actively trying to change this, not in the actual real world, in the small bubble of cult activism, it's getting a lot of attention. There's plenty of research being done. There's some research that has been done, and I certainly have met plenty of at the ICSA conference, the International Cultic Studies Association conference that I went to a month ago. There was a lot of therapists there. So I wouldn't say in the wider world that it's getting any attention at all. So that's my caveat. So I would say that it's a area in New Zealand, at least, that's a work in progress. One of the things that struck me most in the last 10 years of listening to survivors talking about what happened to them, particularly at Centrepoint, but in the last few years I've heard other people talk about other experiences in cults, a bit like you, have heard lots of stories. And that comment about lack of psychological support that was targeted and skillfully targeted at the cult experience, the particular unique disintegration of personhood that happens in a cult. Yeah, people kept on telling me that they couldn't find anyone, and they'd have some really difficult experiences with therapists who didn't get it at all. And it's a work in progress here in New Zealand, because I've been a member of the team over here in New Zealand of the Olive Leaf Network, which is run by Lindy Jacob. I know you've met her before and talked to her on your show before, and plus when you came on Cult Chat and talked to us as well. I forgot about that. Yeah, the Olive Leaf Network are helping to run some workshops with a really skillful communicator and therapist and teacher, Dr. Jilly Jenkinson. She's over here in October after the Decult conference that you're also going to be at, Sarah, as am I. So that's something that's quite exciting, is that we'll have a internationally recognised teacher of therapists to upskill our population of New Zealand therapists in this area. And there's quite a bit of interest, and so that it's really exciting to see the profession of therapists and mental health workers starting to recognise that there is a special skill set that's necessary, that they don't have it, and that this is an area of learning. So I'm looking forward to not hearing that comment anymore from cult survivors, that they can't find a therapist who understands. So, yeah, change is coming, and I feel really excited to be part of that. But playing into the question, sorry, you keep on asking me questions that I answer in a really long way, and then I'm like, what was the question again? You actually asked me how it plays into the pathway. So in the pathway, and so this is something that I get all the time in my work, someone comes in and they want access to a service that I don't really know very much about, and I don't know, this is another way that Health Pathways is really valuable, because there's lots of NGOs out there, there's lots of private providers, there's lots of people working in the health space that's not primary care and it's not secondary care, it's community, often not-for-profits, that are doing really important work. And one of the things that Health Pathways does is kind of fits the service provider to the condition and puts it in the pathway. And that's one way to reduce some of the burden on general practice and the hospital system, is to access this other part of the health system. And so that's something that my pathways on this topic will be doing, is we'll be talking about some of the different, there's not a lot, but some of the providers that are in this space and some of the therapists. So you'll be able to go to your doctor, and your doctor will type in whatever they do to bring up the pathway, and then it will be able to link them to a resource that actually says who the people are who have the skill in this area. So that's actually really quite practically useful certainly for a GP who might not have any idea, but they're on a learning journey, and they can go, oh, here's a therapist who says they see cult survivors.
Fantastic.
Yeah.
This one, I'm just going to throw one a bit left field at you, because you mentioned earlier about there having been some doctors in Centrepoint. Mm-hmm. And I've recently just been speaking with Esther Rocket, she had a very big experience with Universal Medicine, Northern Rivers, New South Wales cult, that has a number of people involved in various healthcare professions. And I've interviewed a woman who she went to see a psychologist who was in a cult and tried to bring her into that cult. And I just wondered about your perspective on medical or healthcare practitioners who might be trying to recruit people into cults.
Yeah, well, I think that was Centrepoint, unfortunately. It was a therapeutic community that started out as it wasn't live-in, to start off with. Burton, Bert Potter was the leader. Him and a group of therapists were running workshops from this house, and over time they got such a following that they said, let's make more impact and move into this live-in community. And initially, I don't know, it seemed like it wasn't a cult so much at that stage. It was more of a movement, maybe. And people all over Auckland were doctors, nurses, people in the hospital were referring people to Centrepoint, because it was at a time where there just wasn't anything like it. And people were at the end of the road in terms of what the traditional health system could offer them. And people would say, look, I think Bert Potter can help you. And, good-intentioned, naive people who didn't know enough about Centrepoint, they got conned in a way as well, because they ended up referring people. And to be honest with you, that sort of thing still happens now, not to Centrepoint, but to, not all of the health and wellbeing self-help space has got healthy, ethical practitioners. There are a lot of practitioners out in the self-help space who are not registered, not safe. So it's still a risk now. It's particularly a risk for ex-cultists, I have to say. They come out of a cult and they're more at risk of being recruited into a wellness, not necessarily a cult, but certainly a unethical, unsafe, not trauma-informed practitioner who's unlicensed. And so, that's what was happening in Auckland in the 1970s and 80s and 1990s. And I think psychotherapists were recruiting their patients. And I think a lot of New Zealand therapists who are practicing today had some kind of contact with, and doctors had some kind of contact with Centrepoint, because they ran these week-long workshops and people went to them. They might have only been there for a week, but they got Bert and his cronies' ideology into their brains. And, it's a bit of a frightening thought to think how much this deeply harmful community with revolting ideology, how much that's imbued the mental health space in New Zealand. We'll never know, but, I think a lot of people went there in the 1980s.
That is a really scary thought. And it brings to mind also a man that I spoke with who he ended up in the 12 tribes because his wife, when she was suffering from, he suspects from postnatal depression, her doctor suggested that she go and stay with this wonderful community that ended up being the 12 tribes, and that's how they ended up there.
There we go. Mm-hmm. Snap.
Yeah. So for anyone who might be listening who's in the field in Australia or New Zealand, what are the steps for this pathway becoming available to healthcare professionals in their area?
Well, first I have to get it live in New Zealand. So that's the first step. I have to get it live in my region, and we've got other regions in New Zealand who are showing an interest at this stage. So after it's live, and it should be live in the next 6 to 8 weeks, so my goal is early October, then it should be able to go live in other regions in New Zealand. And that's just something I'll be working on, encouraging my colleagues to see the value in it and pick it up. In terms of Australia, there's already one region who's interested, so that's exciting. I won't say who. And I'm just going to approach them and see if they'll pick it up. But in terms of how to, if a whole bunch of people went to the doctor and said, I've heard that there's a health pathway on cults, your doctor should be able to press the feedback button on their personal local region and ask for it. And so you've heard this? Yeah.
Fantastic.
Yeah.
Hopefully some people might be able to go and do that in the near future.
Or if you're a health practitioner yourself, you can do it yourself. But who knows? Who knows? I'm pretty motivated to get this onto the desktop computers of as many doctors in Australia as possible, because imagine what it would be like if particular risks and concerns and needs and health outcomes of people in cults were known and deeply understood by doctors all across Australasia, in much the same way that doctors understand asthma or ischemic heart disease or hypertension. Wouldn't that be fabulous? And I think that's where we were with domestic violence. 30 years ago, no one really knew what it looked like, didn't know how to ask about it, didn't have a clue really. But this is the next domestic violence. Yeah, I think health workers or health practitioners are a powerful lobbying group, and you get them caring about it. They've all got the skills to care for this population and do a bloody good job. They just need to know what it looks like. I've seen waves of new knowledge come and go in my career, things that we didn't know and now we know, and it's interesting to watch how that comes onto the stage and how my profession looks around and goes, oh, we didn't know about that. Oh, gosh, we do need to know about that. And then they all start to know about it. So, there's goodwill. It's just, giving them the information. I really hope that the health pathway that I'm creating will do that. One of the barriers for it is usually there's experts, and usually there's a lot of research. It's a topic that is well known by doctors. And there's medical experts. I just have to create a pathway for it. But this is the first topic, and I said I've been doing this job for 10 years. This is the first topic where there are no experts and there is no research. So it's new ground. It's completely new ground. So I've been talking to people all over the world with this one to get input from Norway, Sweden, England, America, Australia, France, all over. Yeah.
Because there are experts and there is research there, or is it?
No. Because
why do you think there is none?
Because, good question. Like, people aren't exploring this particular topic. The topic of the physical health impacts, not just the psychological, but the whole person health impacts. I don't know why. I don't know why it's not being studied. I think cult research is a sort of a small field. I mean, in order to study a group of people, you have to see them, right? You have to see that they are a group. You've got to identify that they're a population, and then you have to kind of start to examine their health needs in order to get incident prevalence data, any data. But if you don't even see them, and I think that's the problem fundamentally, is they aren't seen. They're an invisible population. That is to do with very real factors, huge social stigma. I mean, you've got to be brave to put your hand up and say, I was a cult survivor, got to be brave. Only tonight I was at a function and someone there said to me behind his hand that he was in a group, and it was an environment where it would have been really okay to say quite loudly, but there's still there's a lot of shame, and I think keeping it to it's not safe, and that's the thing. It's not just shame; it's actually not safe currently in New Zealand, and I assume it's the same in Australia, to admit that you were in a cult. You just get ridiculed, humiliated, mocked, shamed, blamed. So that has to change, and I find all of the interest of late, Netflix documentaries and memoirs, fantastic. I mean, it's not all good quality, but I'm hoping that it moves people away from just simple voyeurism into actual compassion. And then, once people stop being a caricature, the cult caricature, and they become a human, then people can start to feel compassion and understanding. And then it's safer for people to say that they had these experiences. And I mean, your work's having an enormous role in that, Sarah. Just making it more normal and safe. I think it's so valuable.
Oh, thank you. It's definitely a huge aim of the show. But even then, it does strike me that I've spoken to people who are listeners of my show who I would expect, and I'm sure they do have compassion and they do really feel for these people, but they do still ask the questions like, why did they stay in such a group like that? Why did they stay? Or they'll say that they would never join a group like that, and there's still that attitude, which I always push back on it, but it is amazing to me that those attitudes are really hard to break through. I think it's self-protection, but yeah.
Oh, of course it is. But yeah, can I ask you a question?
Of course.
One of the ways that I want to get the health pathways into Australia is to understand where the cults are. Because if I know where they are, I can ask those regions, I can point out to those regions that they've got a problem with cults, and actually they do need this pathway in their region. So that's one of my strategies. So where are the cults in Australia?
Well, aside from everywhere, the place that comes up a lot is Northern Rivers, New South Wales. There's a big alternative kind of population around there who I think can be quite open to some groups that turn out to be cultic. But really, you know, the big cities, like that's a lot of the groups are recruiting from university populations. And so, yes, I think you'll find them a lot in the big cities. And then the trickier ones to get to, like the 2x2s are in really sort of regional New South Wales, really small town areas. So, yeah, I'd say there's a couple of hot spots. I was speaking to a guy the other day who thought that around Fremantle in Western Australia there's a bit of a hot spot. I'm not personally familiar with that as a hot spot myself, but that's what he said. I mean, I honestly think it's everywhere. Like that's just it's a depressing answer, but I really do.
Yeah.
I really do.
Well, that's the thing, convincing people that they've got a problem when the population's invisible. And they keep their problems to themselves because it's not safe to share even with their doctor that they were in a cult. So how do you...
And so many people who actually don't recognise for quite a long time that what they were involved with was a cult. So
yes,
how can they even speak that language?
Exactly, yeah. It might take decades for people to look back and go, what I experienced was a cult.
Well, it's even, I mean, I've heard from people who've listened to an episode of the podcast and written to me and said it took me listening to that episode to recognise that I was actually in a cult. Like it can take people a really long time to understand that.
Yeah, exactly. And the thing is that the work is a lifetime. It takes a lifetime, and that whole idea of physically out, or psychologically in but physically out, you know, that idea that there can be a really long gap between when you physically leave and when your brain and your psyche catch up. And that's one of the reasons why, and I didn't mention this, particularly with the second generation, if you're recruited into a cult, you've grown up probably going to the doctor, going to the nurse, getting vaccinations, sitting on your mum's knee when she says to you, hold still, the doctor's just going to look in your ear, it's okay. The doctor is a good, safe person, you know, those kind of messages, or sitting next to mum while mum's getting her healthcare needs met and getting this messaging repeatedly over and over that the doctor is safe and having positive medical experiences. So if you're recruited, you've got that legacy when you go into a group. And even if you have a whole lot of indoctrination against the health system, you still have the basic building blocks for a healthy relationship with the health system. And there's something underneath it that you can go back to when you come out. But if you're a second or multi-generation, you don't have any foundation for a safe relationship with the health system, a safe or a functional or, any kind of ongoing relationship. So if you come out of the cult, whenever you leave as a second or a multi-generation, to then somehow find a way to engage with the health system, it's just massive. There's so much potential, layers of false ideas, fear. I was talking to someone the other day who was saying that with her, because she grew up in a cult, and with her peers of the same age who are also out of the cult, she says they don't even know things like science. They don't even understand science. And that you know, when people are given a medication, that there's scientific trials, and that it's not the same as, you know, your holistic healer who is suggesting some, you know, tree bark that, you know, they've just decided is helpful or not. You know, like there's a real difference. They're not the same. The difference in information or the quality of information is not equal. Science has some, you know, validity and evidence and clinical trials and all these things that create robustness of information. And like that's lacking if you're a second generation. You know, it depends, of course, what group you've grown up in, whether you've gone to conventional schooling or whether you've had schooling that's separate, whether you've had any contact with the outside world or not. So that has a big role to play in it. But like, where do you start when the person has got no idea how to even interact with the health system, doesn't know how to make an appointment, doesn't understand boundaries in a clinical context, doesn't even understand that you take medications regularly, that you need to take the whole course if it's an antibiotic, that it doesn't harm you, or maybe it causes side effects and this is what you have to do. Like, there's just all this learning that is not there. Yeah, it's just like, not to mention the fact that there's all these health encounters, moments of healthcare that never happened as well. So I think it devastates me to think about second-generation adults struggling to deal with complex health needs that may have been entirely preventable because of this appalling neglect of their health needs, and then being trained to be afraid of them. When I was in the International Cultic Studies Association conference last month in Barcelona, there was a guy who was raised in a cult who got up and he was talking about this cult. It was called the Tony Alamo Christian Ministries. And he said, we were given bad information and we are spending our lives, he said something like spending our lives picking up the pieces. But he said we were given bad information on which to build our lives. And that's what it is. It's bad information. And I'm just looking at the health consequences.
It's just such an important conversation, and as you've kind of discovered, like, hugely neglected. And I just want to, really thank you for digging into it with me today. You mentioned earlier the Decult conference, which I'm coming over for, very much looking forward to. I wondered if you could just tell us a bit about the session that you have planned for that.
Well, it will be about this in a less rambly kind of way. Yeah, just sort of going into it in more depth, really, and probably with pictures. Maybe some quotes, like I've been talking to quite a few people about their personal experiences coming out of groups. And that's my opportunity to plug that. There isn't any evidence out there. There's just anecdotal evidence. There's bits and pieces in books here and there. There's personal stories and personal accounts. And I think probably ultimately I've got a research project ahead of me one day. But at this stage, I'm still learning and growing and trying to get more information and noticing the massive gap in knowledge. Like I said, I've just been to this big international conference where all of the brains are, and there's only a few people looking at this, and they're not looking at it in quite the way I'm talking about it. So, yeah. So I need more information. So anyone who wants to talk to me about being in a cult and having this whole area of healthcare needs and how they were met or not met, I'd be really interested in hearing your story. So, you can find me on Facebook, send me a message on Messenger, or go to my website, which is centrepointrestorationproject.com, and you can just email from the site. But I want to hear more stories about people's healthcare neglect or experience in the group of their healthcare needs and how they were met, their experiences with doctors when they came out. Did they have a good experience? Did they have a bad experience? What did doctors do well? What did doctors do badly? Tips. Because I can share those tips with a lot of doctors. That's the position I'm in. So, if some conversations came out of this, I'd be really thrilled.
Excellent. And that link will be in the show notes and on the website so that people can find you and drop you a line. So I hope you do hear from some. And before we wrap up, is there anything else you'd like to mention?
I think what I'd like to mention is twofold. One, that if you're in a group or you have been in a group, take a risk on your doctor. They are caring people who may not get it, but give them a chance and give them time. And to the doctors, you have the care and compassion you need to look after these people, but there's a lot you don't know, and that knowledge is critical. So if you think you might have someone in your practice, and you will, you'll have lots of them that just haven't told you yet, learn more, I think, and maybe get a hand on my pathway.
Indeed. Thank you so much, Carolyn, for your time today. It's been a real pleasure speaking with you.
That's all right. Thank you, Sarah, for having me.
As Carolyn mentioned, you can get in touch with her via the Centrepoint Restoration Project website, and that link is in the show notes. My gratitude to Dr. Ansley for sharing her knowledge with me for this episode. Thanks so much for joining me again for Let's Talk About Sects. As always, you can access ad-free episodes and support the production of this independent podcast via Patreon or with a one-off donation or merch purchase. You can also listen to my audiobook, Do As I Say, which is linked in the show notes, and grab yourself a copy of Joe Gould's soundtrack album, Nobody Joins a Cult, which you can also stream on Spotify. This episode of Let's Talk About Sects was produced and edited by me, Sarah Steele. Original music was composed by Joe Gould.